On April 1, 2016, the comprehensive care for joint replacement model was put into effect, and now these bundled payment models hold hospitals financially responsible for the quality and cost of an episode of care from admission through 90 days post-discharge. In 2014, there were more than 700,000 total knee and hip procedures in the United States, costing more than $7 billion for the hospitalizations alone. The cost and quality of these surgeries varies greatly across providers, facilities, and regions. Where does the cost for knee replacements come from? The largest portion, over $13,000, comes from the initial hospital stay. The next biggest contributor is when a patient is discharged to a skilled nursing facility for rehab, which can cost over $5,000. The remaining costs of knee replacements is made up of other rehabilitation services, costs associated with hospital readmission, and the implant and surgeon. The CJR program has a goal to save approximately $343 million over 5 years. That amounts to a savings goal of approximately $700 per patient across the entire episode of care. Conformis has a unique just-in-time delivery model that offers significant benefits to hospitals. Unlike off-the-shelf systems that require up to 5 costly sterilized instrument trays, the Conformis model includes a single pre-sterilized kit of patient-specific instruments, a single reusable instrument tray, and no implant inventory. The Conformis customized iTotal CR has demonstrated clinical and economic benefits for surgeons, patients, and hospitals across the entire episode of care, from the initial hospitalization through rehabilitation and recovery. In one study, comparing Conformis iTotal with an off-the-shelf implant, use of iTotal showed the shorter length of hospital stay by 1.1 days. iTotal patients were also discharged in under 24 hours at a significantly higher rate than off-the-shelf patients. The study also found a higher proportion of iTotal patients were discharged directly home instead of to a costly skilled nursing facility. Total in-hospital savings was projected based on calculated reduction in length of stay and decreased likelihood to be discharged to a skilled nursing facility. When total cost of care was calculated, the study concluded that iTotal has the potential for savings up to $2,200 per patient from the total cost of care. By shortening the average length of stay and improving discharge destination, Conformis has shown that it can help reduce some of the biggest cost contributors for total knee replacement, suggesting the importance of implant selection on reducing hospital cost and affecting patient outcomes in the new bundled care environment.